Hello, everyone. Welcome to Revising Dentistry. It's difficult to call today's podcast just as any other pediatric dentistry podcast because our today's guest, Dr. Ashwin Jawdekar, has beautifully amalgamated both of his master's degree, which is pediatric dentistry and public health dentistry, and has given us an amazing episode of today's, which we would like to call it as Preventive Pediatric Dentistry or Preventive Kids Dentistry. So let's welcome our today's guest, Dr. Ashwin Jawdekar. Over the past 20 years, Dr. Ashwin Jawdekar has given about 200 guest lectures, authored over 50 publications, one book, and several book chapters. He has achieved a lot of international awards as well, and he is the originator of National No Sugar Day, which is observed on 1st November in India and endorsed globally by various organizations. We'll be discussing a lot more about the two dental Android apps that he has created for the dentists out there. So let's welcome Dr. Ashwin Jawdekar. Dr. Ashwin, welcome to the podcast.
Thank you.
So, pediatric dentistry, sir, how did you get into pediatric dentistry?
Well, I got into pediatric dentistry because in those days, that was about 97, 98, the admissions for post-graduation used to be on the basis of the marks that you obtained in a subject and the total marks. So I had good marks in the undergraduate course in pediatric dentistry. And I was interested in pediatric dentistry, endodontics, and even oral medicine for that matter. But luckily, I got pediatric dentistry.
Yes.
And I didn't have a choice in other subjects, so I took that and I enjoyed that also.
Nice, nice. So, sir, like, how would you describe your journey in dentistry till now?
Okay, so I joined BDS in Government Dental College, Mumbai. That was late in December 1991. And then I completed my internship in 1997. So that was my BDS. Then after a gap of about 1.5 years, I joined post-graduation in Nair Hospital Dental College. And that was 3 years. So 98 to 2001, I did my post-graduation. Then for the first 10 years after my post-graduation, I worked a lot as a pediatric dentist. Initially, a visiting pediatric dentist, I used to go to various clinics for consultations. Then 2003-4, I started my own exclusive pediatric dental practice in Thane, where now I have completed about 20 years. And I also joined a couple of hospitals and I started doing more of clinical practice. And in 2003, I joined a dental college, and ever since I have also been in teaching. Now, in the period 2010 summer to 2000 about 12, those 3 years, I developed interest in public health. So I first went to the US to do a summer training in dental public health. That was in University of Washington. And then subsequently next year I joined a full term 1 year master's program in King's College London, where I did my second master's in dental public health. And so I would say from there my my work changed a lot after 2012 till date. Again, I have been teaching in a college, but I became a postgraduate teacher and I developed a lot of research interest. And we did a lot of research work related to preventive dental care. And in my own practice, I could integrate some of the aspects of public health which I had learnt. Again, focusing on preventive dental care, less invasive, minimally invasive dental care. And I would say I have been enjoying doing more of that. So, if you ask me, I have kind of transformed as a hardcore clinician to a preventive clinician. Of course, I do invasive dentistry, including whatever that is necessary. But what excites me is preventive dentistry. So that's how it has been.
So, something we can call it as preventive pediatric dentistry or
Yes,
preventive
absolutely.
general dentistry.
In fact, preventive pediatric dentistry need not be specified because pediatric dentistry is preventive dentistry.
True.
And you have the best opportunity to prevent whether it is tooth decay, whether it is developing malocclusion, or even some other problems, including traumatic dental injuries. If we take the right measures early enough. So we pediatric dentists, and I believe general dentists who want to treat children, they should be aware of this aspect of
Okay.
pediatric dentistry.
How much of awareness do you think it is there currently in today's generation, like today's kids or today's kids' parents, regarding this topic, preventive dental care?
Well, it is increasing a lot. The awareness is really increasing. I mean, if I go back, say, to the time when I had started my practice, I would often say that even pediatric dentists weren't doing pediatric dentistry as an exclusive specialty. I mean, I didn't know of 10 names who had exclusive pediatric dental practices amongst pediatric dentists. And so, if pediatric dentists weren't confident or weren't able to practice this as a specialty, how would general dentists, how would other medical professionals, or ultimately the end stakeholders, that is parents or children, they would believe that something like this exists? But I have seen that transformation. I mean, gone are those days, at least in the cities, in good areas, that people would just come and tell you, no, 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 these are milk teeth, they would fall off, and why do we require any treatment for the milk teeth? So, in fact, now they are really keen to know more and more about how do we prevent problems, how do we take care of the problems very early. Just to give you an example, at the age of 6 years, when the incisors start erupting, permanent incisors, if there is a little crowding, also the parents come to us and they grab our attention to it. So they are not waiting for even the natural growth to get over. But that is, in my opinion, good sensitization. Parents are now aware and they want things to be started early. So gone are those days when you can tell the patient that no, wait till 12, 13 years of age, let all the orthodontic problem established and then only we would treat it. No. So whether it is caries, whether it is a developing orthodontic problem, treating early or being able to prevent it is the key to practicing good pediatric dentistry. That's what I believe.
What about let's go into the stages of the preventive part. The most common problem that we have in oral cavities, caries, like like early detection of caries or probably prevention of the caries. Let's go from prevention part. Like kids nowadays are too much into of sugar intake. Like the sugar intake has increased tremendously. And have you experienced anything like the time when you started pediatric dentistry? From then and now, what is the difference in the patients that you're seeing?
Okay, on a lighter note, I can tell you this that I mean, when I was in GDC, when I was in Nair, and I mean, generally we catered to children or individuals from lower socioeconomic class, and malnutrition was really a big problem back then. But now, and of course, there were no malls and this culture in Mumbai also at that time. Now, on a lighter note, as I said, malnutrition is a problem. So, as you correctly said, the sugar intake has increased, the consumption of all processed foods has increased a lot, and because of that, there has been a rise in dental problems. Because now, good nutrition or good food is essential for health, including oral health. And in the oral cavity, we see some of the first damages of what poor nutrition can do. Now, let us understand this on a live course. At the age of 2 years, we see a child with caries. Then the same sugar overload, if continues, in early teens, the individual may have obesity. In 20s and 30s, people are suffering from diabetes or metabolic syndrome, and even in say 30s or 40s, people have coronary heart disease and conditions which are all related to sugar overload. Okay, so we pediatric dentists are the first ones to witness the ill effects of sugar. Okay, and that's where I feel is our role, as I said earlier, as preventive care providers. So we shouldn't be just focusing on those teeth which are getting damaged. Yes, it's essential that we treat teeth, but if we improve their diet, it's going to improve their health outcomes in general. It's not just about teeth.
Very true. Very true. So, like when supposingly a patient is coming at your clinic, you examine the patient, you see that the fairly like amount of teeth are having cavities and everything. How do you go ahead with the consultation and like how do you make their parents aware if the parents have come with the patient?
Yes. Now, when a patient is seen by me, a child is seen by me, I first have to confirm whether there is an emergency care required or not, because the emergency protocol is a little different. That means if the child really has got a huge swelling and is unable to keep his mouth open, then it requires, some immediate action. Otherwise, usually I want to discuss with the parents 3 points in detail. One is what is the problem and what treatment could be necessary to solve the problem. Number two, what preventive care is necessary. Why has the problem come? Why the tooth decay has started? And what care should be practiced at home and even in a clinic? What preventive measures we provide. And the third aspect, because it's a treatment for a child, I want to talk about that aspect also, that how is it different from doing it for adults. Because children, unlike adults, they don't come by themselves to a dentist. So they have to be made comfortable. We have to provide them care in such a manner that it is acceptable to them. So these three aspects, related to treatment, related to preventive care, and related to child behavior management, they are to be discussed with the parents on day one, that is during the consultation.
Okay. So you did mention me before this thing that you have an app that is developed by you, something called as Craft. And what this help in the diagnosis or the beginning of what is this app about?
Okay, so I will mention about two apps if you permit.
Sure,
Okay,
please.
one is this Craft app, that
Yeah.
is caries risk assessment for treatment. So today we want to treat caries as a disease and not just as lesions. That means if we say 10 out of 20 teeth decayed in a child's mouth at the age of 4 years, I just don't want to count the teeth like, okay, out of these 10 teeth, 4 would require fillings, 4 would require extractions, and 2 would require pulp therapies and crowns, and give a treatment plan to a patient. I call this a drill, fill, and bill approach. So yes, we have to do the treatments.
Yeah.
But what is more important here is assessing the risk of new caries development. That is, a risk-based approach is needed. And secondly, what is needed is assessing the activity of every carious lesion. So there are treatments, there are procedures by which we can make a lot of carious lesions inactive. Just to give you an example, if there are caries on the incisors in the contact areas, a proximal caries, sometimes just some surface modification, that is proximal slicing, application of fluoride varnish, okay, or at home application of a CPP SAP remineralizing agent, and good home care, okay, stopping the habit of say feeding. So all these things, they can actually help those active lesions become inactive. So our first focus should be to manage the lesions in a less invasive or non-invasive way. So that's why I said not just drill, fill, and bill the patient. So we should make an attempt to make lesions inactive if it is possible. Now the second part, which is related to this Craft, is how do we manage caries risk? Now imagine a child who has been taking bottle feeds for over 2 years, say from the age of 1 year till the age of 3, and now he requires these 10 teeth to be treated. Even if we do good restorative dentistry, if the bottle feeding continues, will I get good results? No. So I have to cut down that risk. And those risk based recommendations have to be individualized, because each child might come with a specific need. No, some children may have a higher intake of sugary foods and beverages. A few may be on bottle feeding. A few may have developmental problem like enamel hypomineralization. So this Craft approach, it basically is an app which has categorized the risk factors in 4 domains, and there is a small history to be taken, and based on the history that we record in these 4 domains, related to diet, related to fluoride use, which is a preventive domain, related to the past and present caries experience, or in case of infants, parents caries experience, and finally some other factors related to hyposalivation, hypomineralization, or contacting of teeth. We record a certain history, and then there is a riskometer. The app gives you a risk categorization, and based on that, specific recommendations can be made to the patient, to parents. So this is like just in a 2-3 minutes of exercise, we can make specific recommendations to parents for managing the caries risk in children. And additionally, the app also gives you an idea about what treatment modalities to consider. So a dentist can generate a PDF for himself or herself also, just to be aware of the entire spectrum of management. Because some things may just be missed out. For example, silver diamond fluoride application. So it's a varnish if we apply on dentinal caries, the teeth in which there is deep dental caries but there is no pulp exposure. About 81% of such lesions can be arrested only with SDF application. So many dentists might miss this particular treatment modality. Again, this is related to making lesions inactive. So in case of children, where we sometimes want to start with non-invasive work because they may not be readily cooperative for treatment. In case of those children whose parents cannot afford expensive treatments, so some of these treatment modalities, they can be they have to be considered, and this craft approach allows us to work with a framework. So this, as I mentioned, the 4 domains and the risk assessment and specific recommendations. More than that, how it helps is, it helps in good patient engagement and monitoring. It provides a framework for counseling and for reassessment also. Say 6 months later, the child comes back. You again check the craft score. You come to know how far the progress is made. Okay, so this is one app. And the other, I will not talk at length as much as this. But one of the things that I always felt bad about was dentists do not necessarily prescribe the right dosages for the kids, because they have to be on the basis of the child's weight. Okay, and I often say this as a joke, that why do we become dentists or doctors? Not because of the passion, not necessarily because of the passion for being a doctor or a dentist, but because we hate mathematics. So in the 11th and 12th standard, we've had enough of mathematics, and then that's how we have become doctors. So, and now you are asking us to calculate those drug dosages, which sometimes can become complex. So what I did was, with some of my colleagues and students, we developed an app, PREASY, that is prescribing children made easy. So the commonly used analgesics, antibiotics, and a few other medicines, you just have to feed the app with the details of the child. Okay, and it calculates the dosages, and it makes a PDF prescription also, which you can share directly, or you can it's an editable prescription if you want to add some trade names, or if you want to save for your records and print, you can do that.
Beautiful.
So these are some of the contributions that I think are noteworthy.
I think, sir, and a dentist is supposed to be a dental artist and engineer all together. And I think you have done all the 3 of it, like doing the dentistry engineering by doing the software engineering. And I know that you are an artist also.
Well, I mean, that's, yes, the engineering or the software development part was done by somebody else. The idea, the concept was mine. And always it's a teamwork. Okay, so I'm grateful to my colleagues, those teachers who work with me, my postgraduate students who did the research work related to these things. And I'm happy to share with you also that craft-based papers, I had won an international award at IAPD for that. Or even the PREASY app that we developed, it won a prize, and we have made publications in good journals on all these projects. So as I said, all thanks to having a good team around me.
Beautiful, sir. So is this app, so as we discussed, this app is available on Android, so you can download it.
Both are Android apps as of now.
Okay. And is it preferred that a pediatric dentist uses it, or even general dentists?
No. In fact, I'll make 2 points here quickly. One is the app is for everybody, for dentists or as well as pediatric dentists. And the second point that I want to make here is the onus of treating children will always lie on dentists primarily. Okay, because pediatric dentists are, yes, required, but I mean, about 40% of the nation's population is young population. Okay, and so they are definitely going to be visiting dentists first. There will not be availability of that many pediatric dentists all the time, because many pediatric dentists, they would be available for specific procedures in a clinic, and before that happens, the dentist has to write a prescription for the child if the child comes in pain. Okay, or if a dentist starts this kind of preventive care before a pediatric dentist comes to do a certain procedure, the parents will definitely value that effort also. And what I wanted was, let us standardize this care. Okay, because different people saying different things, particularly when I teach in a department of a dental college, every prescription that goes out from the department, it has to be standardized. That's what I felt at that time. And even in my own practice, we are often 3-4 doctors. So in order to standardize this, so that the service that we offer has a certain standardized quality. So that's why I felt that, no, I think I've stretched it a little longer as an answer, but the answer to the question is, everybody can use it, whoever wants to use it.
Perfect. Perfect, sir. So now let's get into the most common procedure for preventive dentistry, that is spit and fissure sealants and fluoride application. Like, do you think that it should be done in all the cases, or is there specific case selection that we can do?
You have chosen these two procedures, which I really like a lot.
Beautiful.
Okay. And I gave it a term. Okay. And we had introduced this as a preventive care for school children. That is a fast approach, that fluoride and sealant therapy.
Wow.
That is a fast approach. And we used to treat children from low socioeconomic backgrounds in a dental college free of cost.
Wow.
So anyway, so why I say that these are my favorite procedures, because today we have to practice evidence-based.
Yes.
Okay, and good systematic reviews, that is Cochrane reviews, are available in support of topical fluorides as well as sealants. Okay, so a 6-monthly fluoride varnish application can reduce the new decay by about 43%. Okay, and pit and fissure sealants in first permanent molars during the age of 6 to 9 years, that also has a huge preventive fraction. Wow. Okay, so above 50% caries in the first permanent molars. Yes. And in general, about say 40% plus caries can be prevented with the use of fluoride. Now this is about the two things which we recommend in office. And at home, if we make age specific recommendations of fluoride containing toothpastes and mouth rinses and other remineralizing agents, then I can confidently say that good preventive care has a potential of not wiping out, but preventing at least 50% of the disease burden. Yes. Okay, and that's what we all dentists should aim at.
Okay. So this fluoride calculation that you said for the toothpaste, for the kids and like for the adults, is there a method to it, or?
Now let me talk about the Indian scenario first. Okay. In Indian scenario, there are 3 types of toothpastes available: non-fluoride toothpastes, junior fluoride toothpastes, and regular fluoride toothpastes. So below 2 years of age, I would prefer a non-fluoride toothpaste because the child may swallow a toothpaste. Okay, 2 to 5 years, I would recommend a junior fluoride toothpaste, because it's written also on the toothpaste that for children below 6 years or 2 to 5 years. And 6 years and over, I would recommend regular fluoride toothpastes. So that's one. Now, unfortunately, in India, there is a cap on fluoride content in a toothpaste. That is, a toothpaste cannot contain more than 1000 ppm fluoride. And again, as per the evidence, we should have about 1450 ppm in a toothpaste for it to be really most effective. So there is a solution to this problem. Above 6 years, whoever has a higher risk of caries, I would supplement the fluoride need with daily rinsing with a fluoride mouthwash. Okay. So above 6 years of age, all children should brush with a fluoride containing toothpaste, and those who are at a higher risk. That means whoever has had decay in milk teeth, or whoever has hypomineralized teeth, because about 10 to 15% of children today, they have molar incisor hypomineralization. So then you have to supplement them with fluoride mouth rinse as well. So now the combination, that is good home use of fluoride and the office use, that is 6 monthly fluoride varnish application, has 10% additional benefit. Okay, the preventive fraction that I told you. So that's why I said about we can have this confidence that if we have given a good recommendation for in-office measures as well as home measures, about half the problem, half the menace of tooth decay can be taken care of. Okay, so, and now on a personal note, I can tell you that there are many kids who come to me at the age of 3 years, 4 years, who have an accumulated dental problem because of, say, sometimes a bottle feeding habit or something like that, and then they get the treatment done, and the parents, if they are motivated well, and if they continue the care, then at the age of 6 years they get the sealants done. Then we keep on doing fluoride varnish applications 6 monthly, and I have seen thousands and thousands of such children who never developed caries again.
Wow.
So that's what I want to achieve as a pediatric dentist, and I'm sure every dentist would want to achieve that, not just the solution to the existing problem, but a long-term health outcome.
True. So as you mentioned that in infants, like bottle feeding has been a challenge, like, nowadays, looking at the dental health and the use of the bottle that is increased. So any recommendation or any steps that, post bottle feeding they should follow, so that the apart from the fluoride application and everything in the daily use, that, that can help them to prevent.
Okay, so let me talk about the right feeding advice rather than talking against bottle. Okay, so it is proved that the human breast milk is the best nutrition for a child. Up to 6 months exclusive breastfeeding is recommended, and 6 months to about 2 years or even beyond, continued breastfeeding is recommended. Now, as far as tooth decay is concerned, up to the age of 1 year, breastfeeding is actually protective. Okay, because it has immunoglobulins, and if by then sugar is not introduced in any form, then tooth decay would not start, for a simple reason that the bacteria which ferment sugars, they adhere to teeth surfaces only if sucrose is available in the diet. But unfortunately, once they colonize, they can metabolize any sugar, even lactose or fructose or any other sugar. So that means if we delay sugar introduction and if we continue breastfeeding the child, okay, that could actually protect teeth. But it so happens that, after exclusive breastfeeding phase, the child starts having some weaning foods. Now, a lot of complementary and weaning foods available in the market, or even the formula preparations, they are very sugar rich. Okay, now whatever that you add to the bottle, it could be bovine milk, it could be a formula feed, or a sugar sweetened beverage, sometimes a fruit juice, any of these things, they are going to damage teeth. Okay, so what my advice is, the best advice for me to give is, do not ever start a bottle. Okay, now if you can continue breastfeeding for long, it will be good. Between 1 and 2 years of age, depending on the needs, again this has to be individualized. If the child is having good nutrition from all other dietary sources and the overall child's diet is now balanced, then there is no need to continue feeds. Also from the perspective of immunity, sometimes pediatricians want the parents to continue feeding if the child is falling sick again and again for the same reason, because the child probably has a relative immunological compromise. So at least the mother's milk is providing some antibodies. So based on this kind of an assessment, a feeding advice related to breastfeeding can be continued. I would suggest no to bottle feeding. It's like say no to it. That's what I want from every mother. Now, if it is a must, then yes, some care has to be taken. For example, avoid it at night time. Okay, avoid adding any sugar or any other thing. Yeah, any formula or any all milk additives. They are again rich in sugar. So in one of our surveys, out of some 30 weaning and formula type of supplements, we found some 26, 27 had excess sugar than that was recommended by WHO. So it is like, I would say they are all harmful substances, not just and they are marketed for kids. Okay, so stay away from any additions.
Even kids must be getting addicted to it because of the sugar.
Absolutely, you have said the right, used the right term. And in fact, not just kids, it's an addiction of parents as well. Because see, it's a lifestyle problem. All the diseases that we suffer from, whether it is tooth decay or diabetes, they are related to our behaviors and lifestyles. Now, in a metro city like Mumbai, someone who's working 12 hours a day and is tired when as a parent he's at home and the baby cries at night, the easiest thing for her to do is offer a bottle. Okay, so now that person is cannot change the lifestyle. So finds an easy solution, and that's where sometimes things go wrong. Okay, so say no to bottle if you must give a bottle. Of course, hygienic hygiene has to be maintained. Don't add sugar to it. If those parents who have started on bottle, I tell them that the last drink should be of water. So keep a sipper ready after that. Even after breastfeeding, sometimes I tell them, when it is continued beyond 1 year, that reduce the frequency and offer water at the end of it, or keep a wet handkerchief ready just to wipe off the teeth. If there are only incisors present, it's easier, but not so easy when molars start erupting. So some of these things could be, could help.
Okay. And so we shift from the bottle feeding now to something called as let's just talk about habits, that kids develop in the childhood itself. Like, can you mention a certain habits that parents should be aware of, or the doctor should diagnose it at an earlier stage?
Yes, we call some of these as deleterious oral habits, and the group of habits is also called as non-nutritive sucking habits. Okay, so that means a thumb sucking habit, or a digit sucking habit, or sometimes they have a pacifier habit. Okay, so these are some sucking habits. Also, because of recurrent cough, cold, recurrent upper respiratory infections, children often become mouth breathers, and this is another habit which has its own manifestations on oral health as well as in general health. Now the third thing is, often we come across tongue ties. Okay, we call it frenal tie. So a lingual frenal tie or a labial frenal tie, they also lead to improper function. For example, during infancy, the child may not be able to suckle well if the tongue doesn't get elevated, or if the lip latch is not adequate. Later on, it has further problems. For example, the tongue tie may not lead to good development of speech or swallowing and mastication, because tongue is the organ which allows for good passage of food around the mouth, and it helps swallowing also. So we have to be watchful for some of these deleterious oral habits, and the earlier we diagnose, the better it is. Now, I'm not saying that all these habits and related treatments are easy to offer in the first 6 years of life, because some of them might need surgical care, for example, a tongue tie release. But compared to earlier times, now lasers are available. Okay, so laser surgeries are a lot easier than the scalpel blade surgeries. Also, we can sensitize the parents a little bit about how these habits may complicate things, and then some measures can be started in the early or in the primary dentition phase,
Okay.
and definitely in the early mixed dentition phase.
Okay. Okay. So as you said, the mouth breathers, that the kids, if they get often respiratory infections and everything. So at what stage can we diagnose it? Like at what age can we diagnose it?
Well, it can be diagnosed very early also.
Okay.
And I will tell you one thing that about generally what we recommend is first checkup by first birthday, no later than first birthday for any
Wow.
child. So it is as per the American Academy of Pediatric Dentistry recommendation, a child should visit a dentist within 6 months of eruption of their first teeth and no later than the first birthday. So if I am able to see a child from the age 1 onwards, at every visit, I should be looking for some of these things. One is, are there any factors contributing to tooth decay? So as I said, the craft assessment can help me do that. Second, the soft tissue assessment. I should look for the lip competence. I should look for the lingual mobility, the tongue tie, if there is any tongue tie present. I should look for as well as ask a few questions related to breathing. A simple question to ask is, does your child sleep with the lips parted? Okay. Now it could either be a primary habit, sometimes because of some problem like tonsils or adenoids enlarged, or it could be a secondary habit because there is a tongue tie, the tongue is assuming a lower position and the mouth remains open during sleep. Okay. So also we have to ask some history about the child's diet in terms of, sometimes the parents, they themselves come up saying that my child eats for a very long time, or he has a habit of pouching food in the cheek. So why does that happen? Because probably the child hasn't developed good mastication. And why the child hasn't developed good mastication? Probably because the child hasn't been offered a variety of hard foods of different textures. So this is a vicious cycle. In fact, I have to tell sometimes to parents that imagine there is no processed food in the market and there is no mixer, juicer, grinder at home. How would you offer a child to eat? So there have to be included a few things in the child's diet, such as hard nuts, not soaked overnight.
Yes.
But some hard things have to be chewed so that these functions develop well.
Okay.
Say mastication. And in every assessment, now ideally we should also be doing these well baby type of checkups, no?
Yes.
Whether there is a problem or no problem.
Yes.
So what do we have to do in these checkups? We have to assess risk factors related to tooth decay, risk factors related to traumatic dental injuries also. I will come to that next. And these deleterious oral habits.
Okay.
And also if there are any developmental issues, because we see a lot of hypomineralized molars in the permanent dentition, as well as second primary molars could also be hypomineralized, and that's an indication, or that suggests a stronger possibility of having permanent teeth hypomineralized. So these assessments should be a part of our routine.
Okay.
And then timely recommendations can be made.
Okay. So does a teether play a role in this thing, like whether it's, as you said, that the food there should, if you did not have any kind of mixers or any kind of processed foods, but nowadays people have this habit of giving the teethers at the time when they're putting everything in mouth.
So long as they're safe,
Yeah.
they are not going to injure, and hygiene is maintained, teethers is a good idea, because during teething, babies, they have a tendency to bite onto anything.
Yes.
So rather than allowing them to bite onto anything, it's better we provide them
With
a
a
medical grade teether.
Perfect.
Okay.
Perfect. So coming to the topic which you mentioned, injuries that occur in kids, like what do you say about that?
Okay, so I would say that some preventive dentistry is possible even in trauma prevention. I will tell you how. Let us just look at 2-3 aspects of it. One is, in the early mixed dentition, we come to know about something known as trauma prone profile. That means if the lips are not covering the incisors, if there is 3 millimeters or more overjet,
Yes.
then this is considered a risk factors for traumatic dental injury. So about 15 to 22% is the prevalence of traumatic dental injuries in children. So of which, I mean, this trauma prone profile, I would say it makes the child, I think the odds are more than three times more prone to getting injured.
Okay.
So what do we do about it? Now, two things I would want to recommend here. If there is an early orthodontic problem developing,
Yes.
so we need to guide them about early orthodontic care. So say a simple habit correction, okay, a simple device such as oral screen, a few exercises, we call these as myofacial exercise, orofacial myotherapy exercises.
Yes.
These can help in the reduction of overjet, in improving the lip tonicity and lip seal.
Yes.
Okay. Also, that will have other benefits, that the child will become a nasal breather if he is sleeping with mouth sealed.
True.
Okay. So one is, this is how we can correct the trauma prone profile, and also that has other benefits in terms of health. The other thing is, a simple thing to ask is the child taking up any sport activity which has a risk of fall?
Okay.
Now there can be 3 or 4 categories of sports. Contact sports. Now I have treated a few children for different traumatic dental injuries at the age of 10, 11, and they were in contact sports. They were learning karate or some such skills. Just last week I saw a kid who had fallen and fractured her incisors at the age of 8 years or so, and she was playing skating. Okay, and she had a little trauma prone profile. So I asked the parents, have you been suggested something like mouth guards? Okay, now we dentists have to take sports dentistry seriously, because this is something that parents aren't still asking us for, or neither are the coaches or even athletes are, neither coaches nor athletes are also regularly practicing safe sports.
Okay.
So we have to sensitize parents. So I mean, whenever there is an opportunity, we should introduce these things to them. Okay, so I think early mixed dentition is a great time, so between 6 and 9 years of age, to have discussion related to trauma prevention,
Yes.
correction of trauma prone profile.
Yes.
Okay, then asking questions related to the sports preferences of the child,
Yes.
and suggesting some of these things appropriately will go a long way.
Beautiful, beautiful. So, as you said, that early diagnosis of any orthodontic issues that come. So, I have seen currently that oromyofacial, like the topic of the like myofunctional is increasing. Awareness is increasing a lot. So, and for common people, they should know that there are two kinds of orthodontic issues. One is skeletal and one is dental, and it can be a mix of both. So at an early stage, we can, in fact, in kids, it's the right age to make the skeletal changes, because the growth is beautiful and we can shape the bone in such a way. So what's your perspective on this thing?
Yes, you are absolutely right in saying so. Now let us look at not 2 but 3 issues.
Okay.
One is the development of function. We just spoke of digit sucking or some deviations.
Yes.
Okay, improper swallowing, incomplete lip seal, or various deleterious habits. So they are definitely going to make an impact on the growth and development of orofacial structures, which can make the profile more trauma prone, and which can lead to crowding of teeth, etc. Okay, so first area to diagnose is the orofacial function. Then the second is, because the growth and development is on, we have to look at its impact on the jaws. So how are the jaw arches? How is the relationship, that is skeletal class 1, class 2, class 3, whatever is the relationship of the jaws. And the third thing to look at is the alignment of teeth, or if there are any issues pertaining to that. Okay. Now when we are when we are doing the treatment planning for this, again, the best phase of orthodontic treatment is actually growth modification. The second phase is, they say, dental camouflage. That means now we cannot modify growth further, so let us offer something, a camouflage or a little compromise. And alignment helps achieving good aesthetic dental results. But alignment per se cannot improve function, or alignment cannot improve growth. Okay, and the last phase of orthodontic treatment is surgical orthodontics. Okay, so do we really want to go that far? No. Then, despite its limitations, at least the first thing that we should attempt is improving function through orofacial myotherapy exercises, through some appliances. Okay, I know the limitations of that also. We may not always get the best compliance from the child. Our growth is not 100% predictable. Sometimes it can even lengthen the treatment time. But it's worth all that. Okay. It's worth attempting all this for various reasons. Yes. Okay, so as a pediatric dentist, I would focus on good orofacial functional development and good growth and development of the jaws in the period throughout the mixed dentition. Okay. I mean, maybe late primary dentition to late mixed dentition. That's the period I would choose to make an attempt to take care of some of these needs.
Okay, beautiful. So earlier the better it is, like
Yes.
the more like beautiful. And I think even all the general dentists should be aware of this thing, because this awareness is very less in the general dentists who are like, the first person who come in contact with the patients. Because
see, when I meant pediatric dentist, I actually didn't mean that only pediatric dentists should do this.
Yes.
All dentists should do this.
Yes.
And these are some of, for example, if you are giving an oral screen for the correction of mouth breathing and for improving lip tonicity, this is one of the simplest things to do. Risk-free dentistry, what is the risk in it? True. Okay, whatever that we have discussed so far about preventive dentistry, I would say preventive dentistry is rewarding and it is risk-free. What will happen if you apply 6 monthly fluoride varnish? There is no risk. You read Cochrane review, there is a plain language summary also. There hasn't been any side effect of 6 monthly application of fluoride. There hasn't been any recorded side effect of the toothpaste or mouth rinses that I have mentioned. In the right manner, if they are prescribed, there isn't any side effect as such. So we want dentists to provide risk-free, simple, less invasive care.
True.
And if we are able to sensitize parents for that, that will definitely prevent a lot of need for invasive and complicated care later.
True.
Am I right? So that's all I need.
So, and it's us only who can create awareness in the parents or in the patients.
Yes, absolutely. Because as I said, unfortunately, they're not coming up to us. See, this talks about the entire promotion. Okay, health has not been promoted that well, and oral health also, in my opinion, hasn't been really promoted to that extent that people are coming to dentists every day for, say, mouth guards or for appliances for sleep improvement. Okay, so yes, the time will come for that, but as of now, we have to take the first step.
Very true. Even we should be aware to create that awareness that we are responsible for it.
Correct.
As well.
You're right.
True. Perfect. So, just on this fluoride, as you said, there are no ill effects happening in the fluoride treatments. Is it recommended for adults as well?
Yes, why not? In fact, as I said, above 6 years of age, all of us, we should be using fluoride toothpastes for twice a day brushing. Then mouth rinse if we have a higher caries risk. Also, fluorides can help in taking care of sensitivity. Okay, dentinal sensitivity. It also helps in prevention of root caries. So adults will also be benefited from this.
Beautiful. So, sir, in kids, if there are certain special need, like, special need kids, how do you treat those kids? How do you plan a treatment in such patients? Because they don't have that awareness to take care of their teeth. Not a lot of guardians or parents. It's difficult for them as well. So what is your protocol in, like, treating special need children?
Okay. See, the preventive care is not very different. There are a few additional things in that. For example, they themselves may not have the dexterity to brush, or in certain disabilities, for example, if someone is visually impaired, he or she cannot see the teeth while they are being brushed. So as per the need, we have to suggest an appropriate measure. For example, sometimes powered toothbrushes, that's what I recommend. They are more helpful than manual toothbrushes. Okay. Now this is just one example. In all children with special needs, we first have to assess the degree of their disability and what are the challenges in the preventive or maintenance care, as well as while treating them, what could be the challenges that we need to face, whether they can be accommodated in the dental chair or not, whether they cooperate and comply with the needs of the dental treatment or not. Now, based on the extent of this problem, this challenge, and the need of care, whether the treatment is required is less invasive or more invasive. Sometimes they have an accumulated problem.
Yes.
Because parents, we all feel pity for that reason, is that they are so overburdened with several aspects of care in general, that while planning the treatment we have to bear this in mind, that let us not increase their burden of care.
True.
And let us give them a solution which is practical. Okay, so now the range of services can include, we maintain sometimes problems with very limited care, such as boosting the home care and say fluoride varnish treatments, silver diamond fluoride applications, and some need based care in the dental clinic. But those who have an accumulated problem and they require emergency care, we hospitalize them, and I'm attached to 2-3 hospitals, and we do hospital based dentistry also, like they are treated in the OT, because at times it is not medically safe also for them to be treated in the dental chair.
True.
Based on their the possibility of certain complications, so we provide them hospital based care.
Okay. And that's the best way to, do a very comprehensive treatment if it is required.
Yes.
Like a lot of teeth need to be taken care of. Yes. Nice.
I do hospital based dentistry at least once every week for children with special needs.
Okay. That's beautiful. I think we discussed this before, that you had put an idea for something called as No Sugar Day. What do you want to say about? I want our listeners also to know that story, that how did this No Sugar Day was promoted, put forward from your end, and how it should be a national No Sugar Day or an international No Sugar Day. So I want to know from your end, sir, the story.
Okay. I can go on and on
It's
this topic.
Perfectly fine. We can do a two episode podcast for this. It's okay.
Because those who know me, they know how passionate I am about talking against sugar.
Yeah.
And actually, a good advocacy against sugar is really a need of the hour. Yeah. And I have done a few experiments. I've done some research related to behavioral change related to this sugar addiction. Okay. And I can share 2-3 of such examples with you.
Sure, sir.
See, we know sugar is really deceptive, and it is, in my opinion, worse than tobacco, because nobody buys tobacco and stores it at home and puts in everything from morning tea, coffee to curry.
True.
Am I right?
True.
So, but sugar gets added to it, and it is also a cause for a lot of non-communicable diseases, tooth decay, etc. So, now, why my motivation for advocacy against sugar is, every day I see a child who has all 20 milk teeth decayed at the age of 3 or 4 years. Every day I see a child, because of a swelling or because of incapacitating pain, has not slept the previous night. So what am I doing about that? Just treating the problem, doing root canals and extractions of teeth every day. So somewhere I felt that I should be doing more. And some training and my background in public health, it helped me that we have to approach upstream. We have to have some measures, although symbolic, but they should be at a higher level. True. Okay, like No Tobacco Day on 31st May. It is showcased on media. Different campuses, they observe it. There are marches about it. Now there are some legislations about tobacco, such as in public places it is banned, smoking is banned. So all that has to happen for sugar as well. Okay. Now, since almost 2014, I have been observing my own birthday as No Sugar Day. Wow. And my family, my friends, and even at my workplace, people have supported me in this. So that's how the concept came to me, that we all should have a symbolic No Sugar Day. And in June 22, there was a joint meet of Federation Dental International and Indian Dental Association in Mumbai. And I was a part of that. I was one of the speakers. There were 3 speakers from FDI. and it was about two risk factors, too many diseases. Two risk factors were sugar and tobacco. So I was a national speaker to talk against sugar, and I proposed this National No Sugar Day. And I'm happy and proud to say this, that it got accepted. Our Health Secretary General of Ministry of Health and Family Welfare, Dr. Swasti Charan, he signed a document known as Mumbai Declaration, in which No Sugar Day got conceptualized. Okay. And initially it was kept on 1st September, but for some reasons it got postponed to 1st November. So the last 2 years, that is 22 and 23, 1st November, we have observed a National No Sugar Day.
Wow.
And I want to promote this through your channel
Definitely.
and through this podcast to others as well.
Yes.
Now there are 2-3 things which I want to mention about this No Sugar Day. One is, haven't we all heard of a global approach, that is think globally but act locally? So I am saying this is a reverse global approach, that let us act locally so that it reaches globally. Okay, and it has happened in this situation. I am happy to share this with you, that the last year's No Sugar Day, it has been mentioned on the Federation Dental International's website also, FDA website, even Australian Dental Association, and it was also observed in Trinidad and some West Indian countries.
The same date?
Yeah, the same, November,
Wow.
1st November.
Wow.
So it has already reached a little globally. A lot of dental college campuses last year, they not only observed it, but they participated in a competition held by the Indian Dental Association. So it has become a kind of this type of a local event. And now again, two things in this. To my knowledge, there hasn't been any country across the world that has a National No Sugar Day. Okay, so India is the first country, and I want to appeal to people that, like International Yoga Day is India's contribution globally, so why not an international
No Sugar Day? Sorry,
okay.
yes.
And the second thing is, because you and me, we are dentists, amongst all health professionals, it is dentistry's leadership also that in the battle against sugar, we dentists are leading.
We are in the forefront, actually.
Yes. So I mean that itself will be a good contribution on our part, on the part of our field, dentistry, to lead this battle.
I mean, sure, I'm going to use this thing, and I'm going to promote it like to an extent I can do from my end, and so that we can observe 1st November every year as No Sugar Day. But just what is your birthday, which you used to celebrate?
No, I still observe my birthday as No Sugar Day. It is 9th October.
Okay.
And see, as I said, it's symbolic. I mean, 1st November, or in my opinion, the date doesn't matter. But for everyone to be sensitized, or someday if a media person, okay, or if say a sports star, if they also, are endorsed for this, then the message will become louder, and the message will really reach more people.
Yes, that there should be an observation of No Sugar Day internationally.
Yes.
Beautiful, sir. So coming to this one beautiful thing that you've contributed from your end, I know that we had a discussion before, and you are an artist. You compose music, which is like a beautiful, hobby, and probably you've done it professionally as well. There is one song which is contributed from you for the kids out there on YouTube. I want you to talk about that song. Like, how did you think of it? How did you compose it? And who all are there with you in this thing?
See, I believe in good health promotion.
Yes.
Okay. Because there are so many things luring, attracting children, like candies and toffees and cakes,
so many
and
unhealthy
things. So let us promote health also in a good manner.
Very true.
So one of the ways to do that is, suppose we want to promote toothbrushing.
Yes.
We could upload a song. So we have uploaded a happy tooth song. Okay. And it's in English as well as in Marathi as Sundar Datan Se Gani. So there are 3 purposes for this song. One is we want children to brush for 2 minutes. So the song plays for a little more than 2 minutes, so that it can be played on the mobile, and children are asked to brush until the song is over. The second thing is there is a video, so it demonstrates a child how to brush teeth. Okay. And the third thing is the song also gives some message. why having healthy teeth is important, what are the good habits for healthy teeth,
Okay.
what is the role of dentists in maintaining teeth healthy,
Yes.
and how often should they visit a dentist. So they get some oral health message.
Okay.
So with this purpose, I had written that song, and again, my postgraduate students and a few people around me. I have not taken any names because really there are many names
Okay.
whom
Okay.
I've been very grateful.
Okay.
So they helped me create it, and we have uploaded it on YouTube. So that health promotion reaches homes.
Yeah. Yeah. So this, I think you have made all the efforts from your end just to create a clear-cut message that prevention is better than cure, and it starts with pediatric dentistry, because if at this age, at a young age, if you are aware about it, like you can prevent so many things, so many problems that we encounter day to day, parents coming in with an first molar, decayed first molar at a very young age, like permanent decayed first molar. So that is something that when I see such a kid coming in with such an important tooth and having maximum decay with it, it's really saddening that the awareness should be made, and you have made all the efforts from your end.
But not all. I feel that there is a need to do a lot more.
Yeah, we are on it with you, sir, in this thing, and I'm sure all the listeners out there will definitely start promoting all the things. I want them to start using your app as well, plus promote your song, and plus even the No Sugar Day, which is like a loud message out there for sure from this episode. Some tips that for the dentists currently, first part, and then there'll be tips for parents as well, so that even they can have a look at this part of the video. So first we start with the dentist, some message to the general dentist or the pediatric dentist out there from your end, if you can give.
Well, I would, in order to summarize this, I would just state my broader vision of pediatric dentistry.
Okay.
Basically, we want every child to breathe well, eat well, sleep well, grow well, have a right posture, have a healthy smile, play sports safely, and have an overall good health. And it is from oral to total health. Let us not isolate oral health from any other health. As I mentioned earlier, good diet, good feeding advice is not only for teeth, it's for entire health.
True.
So whenever a dentist sees a child, let the dentist think about these aspects of health and not just about that tooth in question.
Yes.
Okay, yes, that tooth in question is important, but we want to be in a position to contribute better. Okay, so as we have discussed earlier, a good preventive care and continuity of that is essential. So craft based approach to caries management, early diagnosis of deleterious oral habits and sensitization of parents, and timely interventions, early age orthodontics, myofunctional therapy, okay, trauma prevention, okay, and early management of trauma prone profiles. Molar incisor hypomineralization is another daunting problem. Okay, I've not gone into the details of that, but that also requires early care, okay, for the prevention of complications. So these should be the focus areas, in my opinion, for dentists. And for parents, in my opinion, what they should do is, starting from the first birthday of the child, every child now requires a dentist.
True.
So a 6 monthly visit to a dentist, okay, is important, because if the dentist informs them well about all these needs, they would be in a position to themselves get the problem identified and treated without it getting complicated. So that's what I can say in a nutshell.
Perfect, sir. I think we come to an end to this podcast. It was such a beautiful conversation with you, sir. And I think the first molar thing that you mentioned, we can make it a second podcast, later on with that. But sir, thank you so much for coming in. I hope you enjoyed the recording and everything.
Yeah, I enjoyed this experience, and the way you asked questions, actually it really covered a good spectrum.
Yes.
And I am thankful to you for letting me speak about quite a few things which are very close to my heart.
So it's my honor, and it's trust me, even the listeners out there, whoever is going to listen listen to it. They're going to love this podcast because so much of an honest conversation came from your end. So thank you so much for that, sir.
Thank you.
Thank you. Please press like button if you like the video. Share it with your friends. Comment down your views about it or any special requests that you have, and subscribe the channel. Thank you.